Haven't seen me do that for a while, have you? So, it feels pretty good to do it. So thank you all for being here. This is actually a great day. Did not believe that we would need to have sunscreen here in Rochester this time of year, but it's great to be outside, and it's great to be talking about what we're about to announce. So first off, I'd like to welcome some special friends who are here with me. So from the Lake Erie College of Medicine, Dr. Rich Terry, Dr. Michael Rowane, Deb Sanko, and a special thanks who could not be here, Dr. John and Sylvia Ferretti, who are really the founders and the heartbeat of Lake Erie College of Osteopathic Medicine. I'd start off with, I feel quite fortunate because as the folks came in today, it's not new meetings. These are folks that I've known for, in some cases, several decades. In my time in Pennsylvania, in my time in Ohio, I was working with Dr. Rowane, doing really great work in the graduate medical education space at CASE. And so it's great to have them here with us today, seeing many of the exciting things that are going on here in Rochester, and particularly at Rochester Regional Health. Also like to recognize some of our key leaders that are here with us. Hugh Thomas, our Chief Administrative Officer, Dr. Rob Mayo, our Chief Medical Officer, and somebody who you've seen on TV lots and lots over the course of the pandemic, Dr. Richard Allweiss, our Associate Chief Medical Officer and Designated Institutional Official, aka the one who runs all the residencies and fellowships, Christina Gutermont, Dr. Kevin Casey, the president of Rochester General Hospital, Dr. Bridget Weefling, the leader of our medical groups, Dan Ireland, the leader at United Memorial Medical Center, Carrie Cardo, our head of marketing, Aaron Heitz, one of our exceptional lawyers who helped bring all this together, and a number of our key marketing folks who many of you know quite well and who you know to be exceptional. So this is a big day. This is a day we've been working on now for more than several years. So I think most people around the country understand that there's a real need for physicians. There just simply aren't going to be enough physicians to take care of us as we continue to age as a society. There's not going to be enough primary care physicians. And primary care is so important for the good health of our communities. I think today we understand that better than we ever have in the aftermath of a global pandemic. And as we're trying to get people back into offices to make sure they're getting the care that they're supposed to get. So it's wonderful to think about an organization that trains more medical students than any other organization in the entire country, and who trains more folks that go into primary care than anybody else in the country. And given all of the needs that we know of in behavioral health, who has multiple fold the national average of their trainees going into behavioral health than others in the country. These were really important attributes as we thought about who do we want to partner with. So at Rochester Regional Health, as the integrated health system has come together over the last 7 years, as Unity and Rochester General came together, as United Memorial and Batavia and as Clifton Springs came together, and now most recently, 3 hospitals in the North Country, St. Lawrence Health System joining Rochester Regional Health, in Messina, in Gouverneur, and in Cannon-Potsdam. And as we think about our extended network of all the behavioral health, our nursing home facilities, our very large home care footprint, and how all that comes together. How we train physicians, like how you've heard us talk about how we create nurses for the future, becomes incredibly important. So Dr. Mayo and Dr. Allwise have really been the architects of huge increases in graduate medical education that's occurred here at Rochester Regional Health. A 4 times plus increase in the number of those programs. That becomes incredibly important as we think about, are we going to have enough physicians to take care of all of our friends and family in Rochester and all the surrounding communities and in upstate New York? So as we thought about who to partner with, there's nobody better for us to partner with than the Lake Erie College of Osteopathic Medicine. My personal relationship with some of the people you're going to hear from and some of those that work in the leadership spans several decades. We know what they're committed to. They're committed to the growth of that right number of physicians to ensure that all our communities, urban, suburban, rural, throughout all the region we serve, have what they need to be able to take care of all of our communities, to ensure that we have access for everyone around the community, that we're able to use this integrated delivery system, connecting all the pieces and the parts to make it easy for people to get the care that's so important. So we're thrilled to announce today that Rochester Regional Health and Lake Erie College of Osteopathic Medicine are entering into a 10-year agreement where we're going to partner with them as the largest medical school in the country and as their largest clinical campus across all the clinical campuses they have, to make certain that we continue to train that next generation of physicians. We started this a while ago, some 7 years ago, actually before the system even came together as the system, at United Memorial Medical Center in Batavia. That was really where it all began, and we've had such a great relationship there. This became an obvious expansion for that relationship. So all in, when this is going and full up, we're talking about 100 third and fourth year medical students that will be on our clinical campuses. Again, spread throughout the 9 hospitals and the many ambulatory settings that are Rochester Regional Health that are throughout upstate New York. As you may know, Dr. Terry and the leadership of LECOM opened up an unbelievable medical school campus in Elmira just a year ago. They're going to celebrate that this coming Monday. It's a beautiful campus, and what's great about that campus is it's attracting people from the Rochester community, from the Finger Lakes community, from this area and all of upstate New York that are going there. And what's important about that is those folks are likely to stay here, train in residencies and fellowships here, and then continue on and stay in our communities. Again, making certain that we have that next generation of physicians, to make certain that we've got enough primary care, we have enough behavioral health specialists to take care of you and your family. So there's a lot of magic as this came together. This was a long, long time in making, and I also want to recognize our clinical leaders, our many departmental chairs who were part of this process. You know, we're so fortunate at Rochester Regional Health to have exceptional physicians, exceptional nurses. We're better to train medical students than an environment like that in an integrated fashion. You know, so much of my training, so much of my wife's training as physicians came from settings like that. Great doctors, great nurses who allowed us to become the very best physicians we could be. So this is a big deal for upstate New York. It's a big deal for Rochester. We couldn't be happier with the relationship. We've had so much time to think about this and work together and conceptualize what this would look like. And now we're excited to just make it bigger and begin it. So from myself, from our board leadership, and from the entire leadership of the Rochester Regional Health System, our doctors, our nurses, and to all of those from LECOM, thank you so much for making this possible. It's been a pleasure working to make this happen. And with that, I'd like to introduce Dr. Rich Allweiss. Rich has done so much important work in making this happen. He has worked tirelessly. He has been the architect of so much of what I've talked about. It's a pleasure to now bring him up. Dr. Rich Allweiss, thank you.
Thank you, Dr. Bieber. I don't get the opportunity to stand in front of an audience like this and talk about transformational change in medical education. But for Rochester Regional Health, for Lake Erie College of Osteopathic Medicine, that's what this relationship is going to be. And that's what it's going to be meaningful. That's how meaningful it's going to be to our community. This is really an opportunity as we have grown our medical education here with new residency programs, new fellowship programs, to combine our innovative efforts with that of a medical school that cares deeply about the community in which it serves and has created relationships with all of the local colleges to take that student from Rochester, have them in high school or even middle school, reach down, get enrichment, training, mentorship, go into the local colleges, move into the medical school, then come here for their clinical training, and then hopefully stay in the community. As a primary care doctor myself, I really feel the absence of other primary care doctors in the community. And what was so attractive for me about this relationship is some of what you just heard Dr. Bieber say. The largest medical school in the country, producing the largest number of graduates that go into primary care fields. A medical school that puts out more people going into behavioral health, specifically psychiatry, than most other medical schools in the country. That's what my patients need. That's what I need as I get older, as my kids remind me on a regular basis. So I really, the time I spend up here is really, it's just, I'm so grateful to work in this system, to be able to partner with people like those at Lake Erie College of Osteopathic Medicine, the board of directors of our health system, the board of trustees of LECOM. They've made this day possible because we believe in this community. This is going to be fabulous for our community. This is going to be an amazing way for people in our community to achieve careers that they may not have otherwise been able to achieve. And this partnership aligns very well with our strategic priorities, those of Lake Erie College of Osteopathic Medicine. It will truly be a transformation for us and for our community. And it took a while to get here, but it is so worth it. So I'm just excited to be up here, and I want to introduce a representative of that commitment, of how we've had a relationship with LECOM for a number of years that has gone well and has deserved this growth that it's getting. So I'm going to introduce one of our current residents, chief resident at United Memorial. John, come on up here. John is a LECOM graduate. John worked personally with Dr. Terry as a medical student, as well as with our folks at United Memorial. And John is staying here after he finishes his residency to be faculty and provide primary care for the community of Batavia in which he trained. The idea, again, medical education of the community for the community. So I'm going to just turn it over to John and have him say a few words. Thank you.
Hello, everybody. My name is Jonathan Brock. I'm the Chief Resident at United Memorial Medical Center's Family Medicine Residency Program. I'm also a proud member of the LECOM class of 2019. I grew up in Boston, Massachusetts. I was raised by my mom, who's originally from China, and my dad, who's originally from Rochester. Because my family would frequently travel to Rochester for holidays and family gatherings, this community has always felt like a second home for me. Therefore, I was thrilled when I was accepted to LECOM Erie for medical school. I knew that I would only be a 3-hour drive away from my grandparents in Rochester. During my first 2 years of medical school in Erie, I learned from excellent professors in the basic sciences and made friends with classmates that will last a lifetime. Then I was fortunate to spend my clinical years in Elmira with Dr. Terry, where I received an excellent foundation in clinical medicine. As I started to think about where I wanted to do my family medicine residency, United Memorial in Batavia caught my eye, both because of its affiliation with LECOM and its proximity to my family in Rochester. LECOM made it easy for me to do an audition rotation there, and I absolutely loved it. I ranked United Memorial as my first choice for residency, and can honestly say I still love learning and working there now as a third-year resident. Finally, I'm grateful to have the opportunity to stay on as faculty for my family medicine program after I graduate. I look forward to continuing to help teach residents and LECOM medical students in the future. And then I'd now like to introduce Dr. Richard Terry. He's the Dean of LECOM at Elmira. I had the pleasure of working with him for a couple years while I was there in Elmira. Prior to this, he had been working closely with our system on the clinical campus at United Memorial. He also trained in Rochester as dedicated to provision of primary care in the community setting. Please welcome Dr. Terry.
Thanks, Jonathan. And we did try to retain him in Elmira, but didn't have any success with that. But I'm glad he went to Batavia. So on behalf of the Lake Erie College of Osteopathic Medicine, our Board of Trustees, our President, Dr. John Ferretti, our Provost, Dr. Sylvia Ferretti, I want to welcome you all here and express our appreciation to the Rochester Regional Health Board of Directors, Dr. Bieber, Dr. Alweiss. You know, we are excited about this opportunity for our students to train in the largest healthcare system in upstate New York, and one with a sincere commitment to providing outstanding healthcare to the communities they serve. Since the founding of LECOM, nearly 3 decades ago, we've been a leader. We've been a leader in the challenges of healthcare in the 21st century. One of LECOM's founding principles is to improve the healthcare, the quality of life for all humanity. And we do that by providing expanded, enhanced healthcare to underserved populations. And certainly, this collaborative agreement that we have between LECOM and Rochester Regional Health exemplifies that commitment. You know, it hasn't been easy. We've been working on this for over 2 years. Many phone calls and Zoom calls to Eric and Rich. In fact, I think it's the first time I've seen him in 2 years. But through the midst of the worst pandemic in a century, we got it done. We persevered, and here we are. So we appreciate the support of Dr. Bieber and Dr. Alweiss. The commitment to medical education here is unwavering, and really, from what I've seen, unprecedented. The growth here, unprecedented. The establishment of this medical school, LECOM at Elmira, come on, this is Elmira, one of only 187 cities in the country that has a medical school in the heart of an underserved area. But what it does, it ensures that highly trained, dedicated medical students become the physicians of the future, able to deliver high-quality health care to residents of the southern tier and western New York, and frankly, all of upstate New York. And Jonathan is just one example of a manifestation of that. So our collaborative agreement with Rochester Regional Health provides clinical training to LECOM students in the 3rd and 4th year. What it does immediately, what it's already done with the presence we have, it creates a pipeline for students in this area of Rochester, Western New York, the southern tier, to attend college locally in any of the fine universities and colleges. Right here in Rochester and the surrounding region, we have 29 affiliations with schools that enable facilitated admission to medical school, if you meet the criteria, to LECOM. Then they attend medical school with us at any of our campuses, but hopefully LECOM at Elmira, do their clinical training here in Rochester Regional and any of the fine hospitals that we have here, and then pursue residency in the many various programs that they've developed here in virtually any specialty. And then they practice here. That's the goal. So train them and retain them. That is the key. That's what we aim to do with this collaborative agreement. So for all of us here today and all of those who are watching this event, let's make no mistake. This collaborative agreement is a monumental achievement. Because what it will do is lead to a steady supply of both primary care and specialist physicians from Rochester and the surrounding area in Western New York, the southern tier, to practice in this region. And it will go a long way towards alleviating the disparity in healthcare and the significant shortage that we face in our rural areas surrounding us and even in our urban areas here in Rochester, Elmira, some of the other cities in New York State. So thank you very much. I'm forever grateful for this day that's occurred, and thank you all.
Thank you all so much for coming out here today. As everyone mentioned, this is something that's been a few years in the making and waiting to make this special announcement. So media, if you have any questions for anyone, we'll